Heart disease refers to a range of conditions that affect the heart and its blood vessels. Symptoms can vary depending on the specific type of heart disease. It's important to note that some people with heart disease may not experience any symptoms, while others may have noticeable signs. Here are some common symptoms of heart disease. 1. Chest pain or discomfort. This is one of the most common symptoms and is often described as a feeling of pressure, squeezing, fullness, or pain in the chest. 1. It can be mistaken for indigestion or heartburn. 2. Shortness of breath. Breathlessness or difficulty breathing, especially during physical activity or while lying down, may indicate heart disease. 3. Fatigue. Unexplained fatigue or weakness, even with minimal physical exertion, can be a symptom of heart disease. 4. Rapid or irregular heartbeat. Palpitations, a sensation of the heart pounding or fluttering, can occur in some heart conditions. 5. Dizziness or light-headedness. Feeling faint, dizzy, or experiencing episodes of near fainting may be related to heart problems. 6. Swelling in the legs, ankles, or feet. Fluid retention, resulting in swelling, can be a sign of heart failure or other heart-related conditions. 7. Persistent cough or wheezing. A chronic cough or wheezing that worsens with physical activity can be a symptom of heart disease, particularly if it produces pink or white mucus. It's important to remember that these symptoms can also be caused by other conditions, and individuals may experience different combinations of symptoms. If you experience any of these symptoms or are concerned about your heart health, it's crucial to consult a healthcare professional for a proper evaluation and diagnosis. Treatment options for heart disease depend on the specific condition and its severity. Some common treatment approaches include: 1. Lifestyle modifications. This includes adopting a heart-healthy diet, engaging in regular exercise, quitting smoking, and managing stress. 2. Medications. Several medications can be prescribed to manage heart disease, such as cholesterol-lowering drugs, blood pressure medications, antiplatelet agents, and medications to control heart rhythm. 3. Procedures and surgeries. Depending on the type and severity of heart diseases, procedures such as angioplasty and stenting, coronary artery bypass grafting, CABG, valve repair or replacement, and implantation of devices like pacemakers or defibrillators may be recommended. 4. Cardiac rehabilitation. This program involves supervised exercise, education, and counseling to improve heart health and manage the risk factors for heart disease. 5. Lifestyle support. In addition to medical interventions, support from healthcare professionals, such as dietitians, exercise specialists, and mental health counselors, can help individuals make long-term lifestyle changes to manage heart disease effectively. The specific treatment plan will depend on individual circumstances, including the type and severity of heart disease, overall health, and personal preferences. It's important to work closely with healthcare professionals to develop a tailored treatment approach.